Okay, we're going to talk about, well, it's Medicare, the Advantage versus supplements. First of all, I have to get a definition of what that is.
Yeah, so Medicare, the original Medicare, is an 80-20 split. So they pay the 80%, leave you the 20%, couple deductibles that are built in. So the way that people address this 20% copay and sometimes these deductibles is they buy additional insurance.
Right.
And that's either a Medicare Advantage or a Medicare Supplement plan traditionally.
Okay.
So they help fill that gap, if you will.
I've heard of those for a long time and have no idea what it's all about.
Well, someday you'll come and see me.
Oh, I know I will.
So the thing is where this confuses people so much is that our entire life when we work or our spouse works, we get insurance through the employer, and we just take whatever we're given, right? We don't get any say in that. I mean,
not really.
Hopefully the employer provides a nice plan for you, but you're just stuck. We don't have to make that decision ourselves. So that's a good thing, in that we didn't have to make that choice. It's a bad thing in that it doesn't always work out. Well, now when you hit Medicare age, you're on the hook for all of this decision making.
Yeah. Yeah, but you don't have a lot of say-so, though, do you really?
Well, actually, there's a lot of options when you're Medicare eligible. You can go. All the major, Anthem, United, Healthcare, the Aetna, all of those folks, big players all offer options.
Yes.
And so there's a pretty good sampling of these out there. But we have to make those choices ourselves, and it confuses people greatly. And so here's the analogy that I oftentimes use. I like food. I like to eat. Anyone who's seen me will know that.
As do I.
And so I kind of compare these things to a buffet and a cafeteria.
Okay.
So our supplement plans are kind of like a buffet in that they have a higher cost to get in. So a lot of times you're going to see a couple $100s for these things or more, depending on your age. But you're going to have a higher cost to get in. But once you've paid that, pretty well everything is taken care of. So a lot of times people end up with a Part B deductible that they have to pay. They have to pay the premiums of the plan, but they don't get a lot of copay structure. When you go in, you don't get a lot of, $10, $20, $30 at the doctor's office. Most of that stuff's just covered. And so you kind of have your expenses up front, and you can kind of predict these things. My parents loved them. They never had to talk to the billing department at the hospital ever again because it went to the insurance company took care of it, and they were done.
Yeah, I know a lot of people, when you get that stuff, they start thinking in terms of they're nickel and diming me to death here.
Well, right. So the other option is cafeteria, is more like a cafeteria, and these are our Advantage plans. Most of these things have a low or sometimes even a no monthly cost. So there's not a premium or a very small premium. They're more of a pay-as-you-go, like a cafeteria. You can walk into the cafeteria for free, but if you start selecting things, that's when you pay for it.
Right.
And that's the way these cafeteria plans are set up. So you're going to see a copay for the doctor, a copay for the lab, a copay for x-ray, a copay for hospital stays. Everything's got a copay on these Advantage plans. Zero or very little monthly cost, but you pay as you go when you use the product. Oftentimes these are the ones you see advertised on TV. They've got drug coverage, they've got dental, they've got vision, they've got hearing benefits. Sometimes they've got other things that are built into them for enhanced benefits. They incentivize people to enroll in these. But that's kind of a rudimentary difference as a buffet and a cafeteria.
Okay, that's the Advantage plan, the last one.
Yeah.
Now you mentioned, vision and this and that. Okay. Is that part of the other one?
Nope. The supplements, it's all standalone. You have to buy it individually. The same thing with your drug plan. You have to add those things on. But
is that when they start talking about Medicare Part C and whatever? They add other letters to it.
Yeah. So the Part C and those other letters that you're referencing are parts of these plans, the things that we're talking about.
Okay.
So the important thing is we're coming up into this enrollment period from October to December where people can change plans for the next year. And something that we need to kind of keep in mind, some plans will let you freely enroll in. Other plans have limited time frames that you can get into them.
Right.
Some of these, like the supplements, can require underwriting. You have to be medically qualified in order to get into these things. If you select the wrong plan, there can be huge differences in what you actually pay. It's real important that you talk to somebody this type of year that sits down and does a needs assessment, tries to figure out what it is that's important to you, what aspects of your health you need to emphasize, and make sure that you're well covered for, so that you get into a good plan that works well for you. Most people's frustration with insurance is that they're in the wrong plan, it doesn't fit their needs, and there's a better option for them. And that's part of what we try to do here, is we try to help folks to navigate this and pick a good plan.
Better to avoid the mistake at the front end rather than have to fix it somewhere down the line.
It is, because a lot of times enrollment in these things are for the year. And
Yes.
so if you pick a bad plan, sometimes you're stuck for a lot longer than you want to be stuck.
All right, people want to talk to you, want to find out, maybe need a little help. How do they get a hold of you?
Well, you give me a ring here at the Resource Center, the 882-1800. And I wear a lot of hats here, but the insurance side, we run through the Resource Center, 882-1800. Spent a lot of my life working with Social Security Disability and Medicaid and also with Medicare. So especially if you find yourself where you have multiple program entitlements, it's real important you talk to somebody that understands, all of those.
All right, absolutely. You need some help? Give Roy a call.